Yeah.
Are you?
Oh, okay, yeah, that's.
How are you? Good to see you. Everyone. Oh, yes. Yes, well, not every.
See?
Here is that people are talking about previous collaborations and collaboration moving forward. So this is exactly what we were thinking for. Our friends and folks and co-faculty from Extension come to visit us.
Absolutely.
So I wish you were here, for those of you who are on the Zoom. So good morning. I'm Ruby Nguyen. I am the seminar director for this school year, if we haven't met yet. This is the second to last seminar of this school year. We have one last seminar next week, which will be every seminar is special. They taught me to say that on the very first day. Every seminar is in fact special and unique. But next week's seminar is particularly special. And the reason for that is because we'll be ending our seminar series for the school year with Diane Newmark-Steiner. And for those of you who have been paying close attention to our leadership, Diane has captained our ship for nearly 10 years, and we are sad to see her step down in her role as division head. She will be definitely staying among us and rejoining us, regular folk, Diane, as a faculty member. So what we'll be doing next week is we'll be hearing from Diane about some of her research and some of her future directions as it relates to yoga practice and body image. So really exciting stuff, novel things. But we'll also use that time to thank Diane for her excellent leadership over the last near decade as our division head and wish her well as we move forward. She'll be stepping down to the end of June, beginning of July, like around June 30th. I'm sure she's counting the days. But it's a time for many of us to take a break from our work here in the building. So if in case you don't think you'll be around, please do try hard to make it next week for this meeting. We'll be joining her here in person in 150 Gumshaw, as well as online. So we'll have the hybrid capability as well. So please do make the time in your schedule to join us next week. 10 o'clock. So it is my pleasure today to introduce our two colleagues who will also be introducing two additional colleagues from the University of Minnesota Extension Program. There are so many collaborations that we have held as a division with the Extension Program and many more to be. So please welcome Dr. Abby Gold. Abby Gold became the Health and Nutrition Extension Specialist for the University of Minnesota Extension Center for Family Development. She was a nutrition and wellness specialist shared by University of Minnesota and North Dakota State University Extension. That was between the years of 2008 and 2015. From 2015 to 2020, Dr. Gold served as Vice Chair and Acting Chair for the Department of Public Health at North Dakota State University. He taught courses that focused on communication and connecting primary care with public health. He has also directed the Student Applied Practice Experience. Dr. Gold is a community-engaged scholar who has worked for almost every public health nutrition program and as a prevention dietitian in Marlowe's Family Healthcare Center. Dr. Gold is active in the Association of State Public Health Nutritionists and is the current chair-elect of the American Public Health Association Food and Nutrition Section. Dr. Gold holds an appointment as an associate affiliate faculty member in the School of Public Health and provides leadership with Jamie Stay and Katie Arlenhouse for leadership, education, and training in maternal and child health. She is actively involved in both research, evaluation, and implementation of programs that focus on food equity and ending food insecurity, while also promoting access to healthy foods at national, state, and local events. Trish Olson is a product of 3 land-grant universities. Her BS from our Northwest neighbor, NDSU, her master's and PhD from the Ohio State University, and most of her career at the University of Minnesota. As the leader of the University of Minnesota's Extension Department of Family, Health, and Wellbeing, she walked up to me earlier and asked me if I worked with Extension before, and I said no, and she said, well, we've got plans. She seeks to support and improve family health and well-being through connecting a family's lived experience and their cultural knowledge with university researchers and or research. Families served by her department have many assets, yet often lack financial resources. FHW approaches families from an asset perspective, building upon their assets to co-create ideas and solutions for health and well-being. So very clearly from these introductions alone, we are very honored.
Well, thank you so much for the lovely introduction, and we're so happy to be here. We set this date in December. And then, I think we never transitioned to spring, so all of a sudden this popped up faster than I thought. And I thought, how could that be so quick? We actually did plan it in December, but it's been one long winter. So Abby and I met to plan this, and then we quickly knew that we really aren't anything without the people that work with us in the field. And so later on in this presentation, you'll meet Milena and Serdar, two of our colleagues that work with Extension. And in the room, I have two near colleagues, Janice Rasmussen and Mary Marchek. So we understand that not only is it a time to meet for those of us who are in person, a little social time afterwards. So I hope you think you can talk to the four of us in person anytime. But hello, Andrea. But we also know that not everyone is physically here, and we are all quite available through email, and you will find us. We're not in a witness protection program yet. So let us tell you a little bit about our unit, and if I hope I followed our directions right. Just wanted to say, I was just at a meeting yesterday with some folks from the university, and they said, Extension? What's that? And I said, well, and you try to explain it, but I think what's unique about our college at the University of Minnesota is that we get funding and direction from USDA. And I think that's a unique perspective on our unit. We get federal funding for our staff and to pay for sometimes faculty and specialists. They give us direction. Right now, the movement toward nutrition security versus is moving forward, and that all comes from national USDA. So we get opportunities for special grants that's only for Extension, or a partnership with Extension. So while we are sitting here at the University of Minnesota, we can't forget our federal partner who has a big shadow on what we do. But it doesn't stay here on this campus or the other coordinate campuses. The whole thing about Extension is kind of that whole thing. We reach from the university to the county, to people who live throughout the state, and we listen to the county folks to tell researchers at the U what our local needs. That is what we are to do. We are to meet the needs of Minnesota, folks who live in Minnesota who do not take college credit classes. That's our gig. So it's a unique place for us to be. So I have this little slide, but in reality, this is what it looks like. What it looks like is conversations with people in their communities, and the people we hire live in the communities. And I think that's what's important. That this is a photo of Joyce Mickey Brown. She's been with us with one of our signature programs, Expanded Food Nutrition Program. in which, what's the percentage of poverty that's required? 200%? Yeah. Folks need to be, we call it the poorest of the poor to work in this, the program that Joyce works with. And that program has been over 50 years, funded by USDA, implemented here in Minnesota, teaching nutrition education with folks who have resources, but they just need to know how to stretch them further. And Joyce is, I would call, an artist in this work. But I think it's just important that I think you can look at things like this and go, yeah. There's 3 laws that we do: teaching, research, and extension. And then you go and I could cite the laws and all that. Yesterday I was in a program that did that. But really, I think this is a picture that shows what we do. And here's a few words that share a little bit about that, so that sometimes I have to have some guidance so that I don't forget to tell you some important stuff. While I love to talk about pictures. That we do use a multidisciplinary approach, and we really look to see how we can go beyond what. It's not only the content, but it's how we do it. So we have partnership with the Department of Nutrition Science, but then we have to think, well, how do we do it? Where does public health methodology come in? Where does adult education come in? Where does technology education, how to teach through technology? So we really reach throughout the university beyond, vitamin C is important to you. Vitamin D is important, but how we do it is just as important as what we teach. And we look at multiple disciplines to do that. We are important that we strive to have evidence. Sometimes we're in the place that we are creating evidence with our communities because maybe it doesn't exist. But we do use evidence-informed and evidence-based, and Abby's going to talk a little bit more about that. And Extension is an organization that believes in building the community's power and voice. That we don't just come with our slide sets or the old slide decks or information and come into community, do our thing and walk out. But we ask communities, what do they need and want, and how do we co-create it with them? Wanted to share with you, there's some new terminology in our unit, and the terminology is carried by out in the field by no one, but if you want to find us, yeah, you might want to know this. We have often been kind of just called Extension. We're now leaning into College of Extension. We've always been a college, but we're actually using that name boldly. I don't think we were embarrassed of it, but we've always had a dean. And so then that transition that we had a name change. We used to be the Center for Family Development, and now we are the Department of Family Health and Wellbeing. And people, it seems to be in the last 3 weeks that we've been using this, like a lightning bulb. Lightning goes, oh, and so words do matter. And I think family development wasn't cutting it. The other 3 didn't change their name really dramatically, but we decided to, but we did. We had, if you could think about, we didn't have a comma in there as Department of Family Health and Wellbeing. Also, we went, oh, no. I don't think, we're not medical school. So we had to add a comma, and our communications people said we can't have a dash in well-being, even though every literature has it. So communications won on that one. Not that it really matters, but just we were saying Department of Family, comma, well-being, no dash. And it's like, okay. What that really means is I oversee 2 program areas, one in health and nutrition, and one in family resiliency. It represents over 140 folks here from campus to Canada to Iowa, throughout the state. We do have folks with a special appointment or a percentage of their time in family social science and food science and nutrition. And for folks in this room, a lot of interest you may have is in our SNAP education program. For those who are eligible for SNAP or food support, we do side-by-side education, and our FNET program, which I shared with you before. our unit of analysis is families. We really believe that the family is the building block and the building stone for supporting families' health. And so when we work with you, if you want to work with us, or we work in the community, we don't take the kids and put them over here, and we don't take, or say we only do kids programming. We really think, how can we have the, if we do something with the youth, we'll say, how can we talk to the parents over here? Just talked to somebody yesterday about a soccer program. I said, well, that sounds interesting. And how are we involving the parents? For two reasons. Safety of minors is a thing that we take seriously around here. We like to have the parents there, and then we don't have to worry about a lot about some of the safety of minors issues that are important at the U. But I think the important thing is that we look at family and working at the family level. We work with a lot of agencies that support families, so it's not always direct to family. We might do train the trainer, but really it's about thinking of family as an important component to family health. And what does that look like? This is two of our colleagues, Elizabeth Kilo and her daughter, and we've just made a series of videos called Nourishing, and thinking about how does a family support health? And sometimes it is as simple as cooking meals together. Believe it or not, did anything good come out of COVID? And that rhetorical question that I'm asking, and the answer is our cooking classes, or our application of nutrition education. We ended up having to do them online. And guess what? When we did them, they didn't come to a facility or to a church basement or a school. They did the cooking at home. And guess what? Grandma was there. Granddaughter was there, and family cooking classes. It actually became a much better outcome than we ever would have anticipated by having folks just stay at home. We have some programs and some grants where we delivered food and groceries to their home so that they could cook them. And then our instructors were at their home teaching the classes. But I think what this builds upon is our model. I'm going to quick go here, is the model that we are building on and leaning into. And this is kind of a dynamic model that you will see that when we think of health, we look at overlapping knowledge bases. And one is the Academy. We're here today talking about, the kind of content that comes out of this department or division. We also, as adult educators, we know people's experience is important. But the third, that red circle is called Indigenous science. And what we're talking about is what does culture know? What do people know from centuries of where their families have lived and thrived for centuries? And so when we did this program, we leaned into our staff are from around the world. And during COVID, they made some, interviewed their families and talked about what is health and how does food translate to health. And we made these videos, and it was a learning opportunity for us to think about health as medicine. I don't know if you just saw NIH came out with, what's your thoughts? What is a request for information on, well, we have different information to share than we would have prior to COVID because of this type of exploration that we do to think, well, how is food medicine? What does that mean? And here in our work, I just wanted to share it from a background that we stand on the shoulders of a long history of a program or content called Family and Consumer Science. And that really looked at nutrition, parenting, personal finance. But as we live in our world today, what does that mean for today's needs? And so we are definitely a dynamic organization where now we're looking at obesity, chronic illnesses, substance abuse, mental health, and those are all in our portfolio work. also. Oh, vaccine education, yes. This is probably not new to you, but we embrace the spectrum of prevention as a way that we do our work. Historically, I would think extension in our unit would have done primarily their work in direct education. And now, not only do we embrace all levels of change, but we also think about, let's see, where was I going with that? All levels of change, and we do it together, that we do both direct ed and community work simultaneously. And I think that's why we have had some really great collaborations that we talked about. Okay, I'm going to turn it over to Emily.
Thank you, Trish. Welcome, everybody. What I'm going to talk about now is really what are some of the opportunities for us to work together, for collaborations. There are already a lot of them happening, so I'm going to highlight some of our current collaborations and also some of our past ones, and also talk a little bit about students. But I want to start with our program, the SNAP-Ed program, which many of you are probably familiar with. And just kind of a high level overview of this very large program that we administer through the Department of Families, Health and Wellbeing. So one of the great tools that our colleague Hyunjin Kim and some students have developed is something called a Big Map, which helps us layer some of our programs and where we are across the state of Minnesota, so we can see what's happening out there in a bird's eye view. And one of the great things about the Big Map is the Minnesota Department of Health now is also very interested in the Big Map, and we're collaborating with the statewide health improvement program, OSHI folks, to kind of layer even more data points onto this Big Map. So this is just an overlay of the Twin Cities Metro and the different kinds of programs that we have within the metro area. And each dot represents a program in a different category. And here is the state of Minnesota and all of our programs. And really they're kind of all on top of each other. So you can't see kind of the whole thing. You have to zoom in a little bit closer. But you get a sense of all the different types of places that we are in, and helping to develop both direct education and policy systems and environmental kinds of programs that we do. So the Big Map is available if you ever want to take a look at it. We can share it. This is a slide of just kind of describes the overarching way that we think of interventions and strategies within the SNAP-Ed program. And the SNAP-Ed program historically was a nutrition education program way back when, maybe not too far back, maybe it was like 10, 12 years ago. You could not teach cooking skills, and you couldn't do cooking a demonstration to it was all about nutrition. Here's the nutrition facts and here's how to budget, and it was very not very hands-on. And then finally that changed, thank goodness. Cooking Matters came on the scene, which was, many of you are probably familiar with that curriculum. It's very hands-on, very community oriented. And so SNAP-Ed now is more of an obesity prevention program rather than just clearly a nutrition education program. They also recognize the value of physical activity, which was not something we could even talk about before. Oh, and we couldn't even really talk about disease. So there was no diabetes treatment. We still really can't do it. It's semantics. It's about diabetes prevention. So I'll talk a little bit more about that when I showcase our signature programs. But so we have 3 areas of programs and interventions that we look toward: the research tested ones, the practice tested, and then emerging programs. And all of these 3 different kind of definitions are ones that are allowed in the toolkit, which is out there on the internet. Everybody can go look at what's in the toolkit. There's hundreds of curricula in there. And it's almost overwhelming. But what we do in our center or in our department now, and also within the departments, our academic departments, is help to build the evidence around these programs. And that's why we need to collaborate with each other so we can build strong evidence for why these programs are important and how we can implement them in the community. And so then here is just a list of our direct, and it's not an exhaustive list, but these programs are ones that our educators like Milena, who will talk in about 5 minutes here, use in the community. And some of them you are probably familiar with. The big ones that we've been really working with is I Can Prevent Diabetes, which is the diabetes prevention program. And an example of the research that we've done around ICPD or DPP is Marla Reichs, Kate Welshons, Nikki Johnson, and I have a paper coming out that evaluates the virtual versus the in-person deployment of ICPD. And we found no difference. So that's really cool. You know, it's a good way of showing that we can deploy this program without a huge amount of resources, and it works just as well virtually as in person. That's a pretty good finding for our programs. Go Wild with Fruits and Veggies and Whole Grains is our big signature program that almost all third graders that participate across the state of Minnesota in SNAP Ed, and the SNAP Ed eligible schools are exposed to. And that program's been around for a long, long time, has a good evidence base behind it. And the Padres Preparados, my Spanish is so bad. I took French in high school. I apologize. I'm totally useless. Wish I had taken Spanish. Now, I suppose it's not too late, right? Anyway, that project is an AFRI funded project that we are hoping to do a 2.0 of in this next round of AFRI, which we are all probably from know the grants due in August. We're all like scrambling to get our AFRI grants written. But if you have any questions about any of these programs, just feel free to ask us today at lunch if you're able to stay for lunch. Here's some of our PSE programs that we are really proud of. Systems Approaches for Healthy Communities. Jamie Stang has done an amazing job like helping promote systems approaches across the United States. We have people now in all over the United States using this program. It's just a way to help our SNAP Ed educators originally learn about PSE, but also now public health agencies and maternal and child health professionals all across the country are accessing that online curriculum. Super Shelf, we have Patrick here and Melissa here helping us with, I believe, and maybe other people in the room are involved with Super Shelf in some way. Caitlin Caspi, who we all miss and love and miss, who is now in Connecticut, helps springboard Super Shelf. They're just smarter lunchrooms. We were like at the forefront of introducing smarter lunchrooms into the Minnesota school cafeterias. And a lot of those strategies are probably still in place across Minnesota. So we, like Trish said, looking at the spectrum of prevention, it's not that we do PSE over here and direct education over there. We really try to connect the two so that communities are getting a full wraparound approach to our programs. So I'm just going to give real quickly some evaluation examples. Our our research is really evaluation because we are most interested in learning about how programs kind of operate in communities, effectiveness, right, rather than efficacy. And so a lot of when we go to IRB, we're able to say to IRB, hey, our research that we're doing is really about quality improvement. And so we are interested in developing that evidence around the programs. And whether it's already an existing program or a program that is an innovation that is up and coming, and we want to see how it works. So we take from the program development from the formative stage to the summative stage and beyond. So we have a great center within our department, the Applied Research and Evaluation Center, that Janice is heading up right now. She can, I don't, is it, what do we call that? Is
Well,
it
it's just program development
Yeah.
and evaluation.
program development? So the
Unit,
name
yeah,
actually
unit.
is Program Development and Evaluation.
Yes,
right?
it's put together.
Yeah.
Right.
So that's cool that we connected those two. We use multiple methodologies, both qualitative and quantitative. We lean in a lot on the qualitative side of things, especially in that for those formative stages. And some of you may be familiar with the Minnesota Food Shelf Survey. I know you are because you're helping us with it. But that's a surveillance survey. I think it's in its third iteration, and we have over 7,000 returned client surveys. And also we have the manager survey that Mary said was just getting analyzed with some interesting results coming out of there. So, so here are just like real high level past collaborations that we've had with public health. I'm sure I'm missing a ton because I only have 2 examples here. But these are papers that were published. Dr. Harnick was on this paper about the school breakfast program with one of our extension educators, Mary Schrader. So we're always looking for faculty across campus to work with our extension educators because they have a promotion process. They're also considered faculty on campus, and they have a promotion process. They don't have tenure, but they have promotions. So assistant, associate to full. And so they also have a scholarship aspect to their promotion. So we're always looking for collaboration. Another paper that came out was with Katie, and Katie again worked with Mary and myself and a couple MPH nutrition students. So this came out recently, and again, I apologize. I only have 2 publication examples, but I'm sure there are way more. And here are some current collaborations that we are working on with all of you. And so the first one that I want to talk about, and this is where Milena is going to jump in. So if you want to get her, oh, there she is. Can you see Milena? No, I have to move this over so you can see her. Okay. There you are. We can see you now on the big screen, Milena. So Milena is going to talk about a collaboration that we have with a couple students in Katie Arlinghouse, Mai Tao and Rita Stevenson. They wrote a grant to the Healthy Foods, Healthy Lives Institute. It was a graduate student grant. It was awarded. And they're looking at a needs assessment for home gardening resource needs among low-income families with children. And these 2 students have worked so hard this year, and they are learning so much, and they're going to get to present their findings in Denver at the Association of Public Health Nutritionists Conference. So I asked Milena to help us with recruiting participants for the research, because it's an interview study. And so Milena is going to tell us a little bit about what she does, but also a little bit about how she was involved in this program. So take it away, Milena, and tell me when I should switch the slides.
Okay, thanks, Abby. Good morning, everyone. My name is Milena Núñez Garcia. I am a SNAP Ed Health and Wellness Coordinator in Rochester. Thank you for inviting me today to talk about my experience working with May and Rita on the Home Gardening Resource Project. My participation on this project was helping in the recruitment of participants to interview. It sounds simple, but it's more complex than it seems, since there must be an established relationship with the community to facilitate a recruitment process. I want to say that Olmsted County Public Health is one of my biggest partners for PSE, Policy, System, and Environmental Change projects. Working for more than 8 years with the community, I have learned that working in partnership and including the community when we are planning and organizing our projects is the key to successfully achieving our goals as community health educators. Our departments go hand in hand, and mutual collaboration is important and necessary to meet the health needs of our communities. As a SNAP Ed Health and Wellness Coordinator, I serve as a bridge between the community and other university departments, agencies, and community programs. My roles give me the opportunity to work directly with the community. The time I spend and invest in my participants during my classes, projects, or other activities gives me the opportunity to build strong and trusting relationships in the community. I always try to build good communication with my participants. Being flexible and accessible helps me to be able to contact them easily and stay connected with them even after a class or project ends. It is also important for me to listen to my participants, to know their needs, so I can know when and who to invite when opportunities arise. When I was asked to help on this research project, which was looking to do an assessment of home gardening resource use among low-income families with children, I immediately knew the great need to do this assessment and who in the community will be interested in participating. Working with the Hispanic community in Olmsted County, I have learned that there is a lack of resources related to gardening, and only a few of them are inclusive or culturally appropriate. It has always been difficult to me to find educational gardening materials in Spanish that apply to the growing season in Minnesota. So I decided a few years ago to start creating educational gardening videos as a resource to my participants. And at the end of last year, I decided to register to take the Master Gardener training course this year. I was happy when I found out that May and Rita's research project wanted to interview the community to find out specifically what the community needs and what the community wants to see in terms of home gardening resources. By including elements in this research study, such as a community leader to serve as a connector with the community, in this case, myself, created a Spanish and English flyer to be shared with families explaining about the project, perform interviews in Spanish or English in person via Zoom or by phone, offer participants a choice of Walmart or Amazon gift cards as incentive. It surely helped us in great way to find people interested in participating. I will say that people of the community are very perceptive. They know when someone really cares about them and really wants to help them. In this slide, I want to share with you some photos of one of my garden projects in which Olmsted County Public Health Trish has been a great partner. In 2017, I started collaborating with the Rochester Seventh-day Adventist Church in this community garden. You can see in the first photo when we started. The initial purpose of this community garden was to help bring a wide variety of fresh, healthy, and affordable organic vegetables to residents of the community, and educate them about garden practices, healthy eating, and outdoor exercise. But over the time, we have seen many other benefits that the community has had with this community garden. Changes and improvements to the garden have occurred each year. Public health helped us to start this garden. And when the pandemic arose, public health helped us to adopt new community garden safety protocols related with COVID-19 and purchase necessary materials for our community garden, such as a hand washing station, a new water tank, design and order a new beautiful sign, purchase a tool cabinet. And last year, public health helped us to buy the materials needed to build a beautiful new fence for the community garden. The group photo was taken after the fence was built with the help of some of the residents of that community and representatives from the Rochester SDA Church. The photo on the right is Anna, public health community health specialist, and I, after finish all the details of the new fence. I have also a short video about the construction process of the new fence. So I don't know if we can share it now, a short clip, or maybe later.
Yeah,
What do you think?
I think we'll keep the link to the video in the slides and people have access to it afterward if they want to see it.
Okay.
If that's okay?
Yes, perfect. I want that you see all the work that we made building this fence and how people collaborate together. That's amazing, you know, when you see a lot of people working for one goal. After May and Rita's research project is completed, I look forward to hearing how to increase gardening access among my participants based on the needs assessment results and the recommendations on how to improve access to existing resources and further develop more resources to meet the needs of this population. On the previous slide is my contact information. Please feel free to contact me for any question or future collaboration. And I want to say thank you so much for working shoulder to shoulder with us to bring health and wellness to the entire community. Thanks.
Thank you, Milena. That was wonderful. Okay, so now Serdar Mamedov has joined us and he is going to talk about an exciting collaboration with actually Jamie and Melissa and also Hikaru Peterson from AFNR and this is an AFRI grant that they're working on called Putting Down Roots in Rural America, place-based multi-component approach to improve healthy food access for immigrants. Thank you, Serdar, for joining us today.
Good morning, everyone, and thank you, Dr. Gold, and thank you, Dr. Olson, for inviting me. My name is Serdar Mamedov. I'm extension educator at the Department of Family, Health, and Wellbeing. And my role as an educator is to collaborate with local communities to promote healthy food environments, develop and conduct culturally appropriate learning opportunities for different audiences, and also contribute to public health knowledge. So as Dr. Gold mentioned, currently we, together with Dr. Peterson from College of Food, Agricultural, and Natural Resource Sciences, Dr. Laska, Dr. Karnik, and Stang from School of Public Health, we submitted a proposal to USDA NIFA AFRI competitive grant program. In that application, we proposed an integrated project to address needs and barriers for better food security and nutrition outcomes by co-designing solutions with Somali refugee and immigrant community members and field testing development interventions. Next slide, please. So in general, refugees and other low-income immigrants, they are very vulnerable to dietary acculturation. So, and Minnesota receives a significant number of primary and secondary Somali refugees. And the majority of refugee arrivals in Minnesota settled in Hennepin, Stearns, and Kandiyohi counties. So refugee, they frequently relocated to places or called impoverished areas with limited resources upon their arrivals, and in such localities, the retail food landscape is generally inadequate and dominated by small scale stores. And we're talking about small size ethnic Somali grocery stores. Next slide, please. So for this project, I utilized my connections to the Somali community. I have a long history of partnering with different Somali community partners, addressing different issues that really matters to their communities. So for this study, we secured a robust and support and commitment from the Somali community, including business owners, nonprofit organizations, faith-based organizations, Somali women organizations, and Somali media organizations. So with each of these partners, I have done different projects in the past and was able to build trusted relationship with them. Next slide, please. And for this project, there are priorities. So these are project related priorities. So assess the community needs and values regarding nutrition access, co-design place-based solutions, develop solution-oriented models, and field test them for the potential for improving food security and nutrition outcomes. And very important priority is assess transferability of process and outputs to other rural immigrant communities. Next slide, please. So upon the completion of this research, we expect short-term and mid-term and long-term outcomes. In the interest of time, I would not read all of those outcomes, but if you are interested to know more about the project, or if you are interested to somehow support the project or joining the project, please reach out to me. And thank you so much.
Thank you, Sardar. That was really great. And thank you, Milena, for being here today. I just have one more slide actually, and I really want to highlight how appreciative we are of students that are able to come to Extension it's a really great, it's a give and take. It's not just us giving and them taking. It's really, they give a huge amount of work and energy and passion to our program. So just in the past year, and I'm sure I'm leaving students out too, because I don't know of all the students that we've worked with in the past year, because there are many of them. But just within the public health, nutrition, and I think community health, we have MCH. So my Tao, of course, she worked with me. She wrote the grant that they got from Healthy Foods, Healthy Lives. Cassie Edlund also worked with me, and now she's employed by us. She's our our storyteller in our department. We're so lucky to have her because she's amazing. And she worked on a journey mapping project for something called Nourish and Flourish. And then Becca Ciccone, she worked with me this fall. She learned, it was her very first semester. She came on board. She just fit in so beautifully right away. She helped me with the Photo Voice project. She dove right into the community. We did this great fun project with using Photo Voice in community health support programs in the Twin Cities. And then she did an analysis, and then she made a website. I mean, I couldn't have done that myself. So grateful. And then of course there's Lauren Roach, who still is one of our graduate research assistants. And she's been working with, she just did a seminar called Mapping the Opioid Crisis in Minnesota. I don't know if any of you were able to see that, but she's on one of we have several grants that work with opioid prevention in primarily northeastern Minnesota. So just that's just a short list. You probably know many more students. And so, like I said, it's a give and take, and we love having. So I'm just gonna leave us with this last slide. This is a picture of beautiful area of Croatia, Sitvica. And you can't inject more. I just like this because we're always so time crunched because we have so much going on. We're like Renaissance people. We love everything in extension. We want to learn, we want to know more. We want to be involved. And so you can't inject more time into your life. The challenge for all of us is to put more life into our time. So that's it. And are there any, now we have 10 minutes. For
So I'm
questions.
thinking that, we'll be around, but especially for Serdar and, questions that people have for Serdar and Milena, that this is a time will be, kind of going off the Zoom at 11. So we could prioritize questions to them. If anyone wanted to have it, if anyone had questions. Okay, I'm gonna carry the mic so that it gets captured on Zoom, right?
I think they have mics at their.
Oh, do
table.
you have it? Oh, does that work? Okay.
Never noticed.
Hi, everyone. Thank you for the great presentation. This is Melissa Laska speaking. I wonder if, and this is kind of a general question, Serdar, Melania, other people. How can our faculty and staff interact with folks in extension in a kind of a meaningful and open-ended way? A lot of the hypothesis generation and the ideas that we come up with for research, we want to be grounded in the community, and these folks, the extension educators and specialists that I've worked with know the community inside and out and know what the issues are and know what'll work and won't work. And so some of the generation of meaningful collaboration takes the kind of percolation of ideas from the ground rather than us dreaming up a research idea and then, emailing Trish or Abby and saying like, hey, we have this great proposal. Do you want to be on it? So do you have ideas for how we can kind of interact at the ground floor to really learn from our colleagues that are in the field?
Yeah, and I'm looking at Mary's doing this big, Mary marching the big, so I'm gonna actually pass it on to her. And also share with you a new model that we have where we do kind of vet opportunities, but I'll let Mary start and then I'll do cleanup.
I think one of the most important ways, thank you, Melissa, is even before you have an ideal for a grant, to connect with the community, connect with us and our people out across the state. They can help to identify the kinds of research questions that matter for their families. I would say the other thing, and I'm so glad to see the 10,000 Families team here, but Andrea and Clement, they come to things that we host, even if it's not going to meet their needs, and it's just to be there in the community. And when community members see you coming and hanging out and being part of the community, there's greater trust, and they're not gonna tell you stuff that they need or want to anyone because they've been hurt by institutions for generations. And so I think part of just being with and being in the community for no reason than to be with them rather than to get something out of them or extract something from them is a really, really important model. But also just come and visit anytime you want to come out and see our programs, connect with our research. We do a lot of applied research in the community. We would love to connect students and faculty from any department to just come out and be with us as we're out there doing the work in the community. Sometimes it's really messy and hard, and you just have to be ready for that. But yes, being there. So Patrick's smiling, he knows.
So I have two questions, and one, I just want to build on what you said. So when you say come out there, so for example, we have training programs. Here. What would that mean? In touch with you, we bring our trainees, I mean, yeah.
Yeah, no. Some of the like bringing things out, poor Andrea and Clement. I think you guys had that kind of an ideal, like, oh, we want to work with extension so we can bring our stuff out to you. But what they've learned is you kind of have to spend time being in the community and learning from the community and showing up before you bring your stuff.
Oh,
and your
sorry,
training.
that wasn't what I meant to
Oh.
say. I meant bring out our trainees to, like, we have a training program. We
Yeah, oh,
wanna,
I
let's say,
see.
link our trainees to,
Right.
to
Right.
opportunities in the community that come out to us. So I'm just like kind of envisioning what that.
Yeah, no, if you just would connect with Trish, Abby, myself, any one of us, anybody in extension, it's like a big ball. So wherever you touch in one place, you're getting the whole of us, not just that person. And so if you connect with one of our department people, then we'll try to make this work for you, and we'll work with you to kind of design opportunities that would not just benefit the people you're training, but also our communities. We're really, sometimes I don't know, Andrea, if you have any thoughts about this, but we are pretty protective for good or for bad of the communities that we work with, because we can't leave after a project ends, right? We're in that community. And so the relationship is probably for us the most critical aspect. And so we just want to make sure and ensure that there's mutual benefit for sure and co-learning for sure. So.
Yeah,
Andrea?
we've certainly found that we really have to listen. We have to be open to criticism that will come, and take that and expect it. And that's part of building the relationship. Yeah,
I
And
don't
it
know.
doesn't-
if-
It's feedback.
Yeah.
yeah, sure.
No,
We will never turn
Yeah,
away
combination.
good ideals from other colleges and departments. Because there's so much need and value that the university knowledge can bring to the community. And so we try to work with you on these things.
It needs to be muted.
Right, right.
And then can I ask my second question?
Yeah.
So either of you, or since I can ask one of you and it's all of you. Um, This is kind of a more practical, a very more narrow question, but okay. So often we want to work with a community advisory board, and listening to you, it seems like, I'm wondering if you do that with groups, what your thoughts are on that.
We actually last fall spent quite a bit of time studying community advisory boards and really kind of thinking through what those mean for our programs. And I mean, I think they're important, but they also take a lot of time. They take a lot of energy, and they have to be done right. I mean, there's definitely good ways and some not so good ways to do those tabs. So, but if you are in need of community advisory board members for your projects, we could probably help, find people that would want to be engaged with your project, if that's what you mean, Diane. Like, because we do have the connections, like Serdar and Melina know people in the community, so leaders in the communities all across Minnesota, so we could probably help tie those in. But for our own purposes with tabs, we're still studying them and kind of thinking those through, how we would use them in our programs.
to hear more about that, but I'll let.
I would just say one of the emerging kind of best practice for that is if you saw our model of the different knowledge areas that we value, academic knowledge and people that we might bring in as experts from the academy, they have a certain amount of, like, there's incentives and other things to be part of something. So if we bring community knowledge and community expertise, we are also saying that that knowledge needs to be incentivized. You have to build in dollars for not just their transportation and the per diem stuff, but also their expertise and knowledge. So it's something that we are making sure we go after when we get right grants and stuff to build in that. And for them not to be given $25 gift cards, but actually invest in what would we pay for an expert from the academy and give them comparable compensation.
Yeah, for sure. That's a good point, Mary. Clement has a question, or it might be a comment or a comment.
Good morning, everyone, and I hope I am not too close to the camera, so I will be. But just to comment, at 10,000 families, we have a community advisory board is very strong, and we can help you understand how we did the process. It's not an easy process, and it's not a short process. But the most important thing that we have learned is that you don't have a community advisory board to have it. You have it to listen to people. And I always say, this is my own thing, you have this baby that is your research, and nobody likes for someone to come and say that your baby is ugly. So, but you need to be prepared for people to say that. And because of what Mary was saying about research and about the past, it is very important that you are prepared to know what you can change, what you can act on, to be able to listen more than to speak. And the community will embrace you if you do that. But if you just have it to have it, it might be more hurtful than helpful.
Thank you, Clement. That was really.
Yeah, I was gonna mention, I see we have another colleague from our department. Trina Adler is on the Zoom, and Trina, I'm not asking you to get online, but I just wanted to say that Trina was instrumental in working with the 10,000 Families Project in supporting and building the CAB. And, you know, you're right, oftentimes, and so just kind of what that meant, many activities built before you found people to them too. It wasn't your first time you met somebody, you say, hey, you know, I swiped right and it looks like we're a good match, you know, and so how do you met with people many times before you ask them. But we also try to think about what are already going in the community that you could tap, you know, the local ship boards might be a place to go, and to think about, but what it usually means is it doesn't mean 8 to 5. It's meeting in that evening or over dinner, and you feed them well, really good, and you meet at the times when they're available, and not when you would like to meet, you know, and so, and I think I'm talking to the choir here, you know, so, but that's those are things that help support. I'm conscious of the times. We need to shut her down at 11, or what's your? So we're guests. I just want to say, Sardar and Milena, thank you so much for giving me.
Thank you. Bye.
Oh, okay. So thank you again, and we look forward to learning more about your future collaborations and any bridges that you've been will be able to build too. So thank you.
Thank you. And then we'll be around, if there's this second part two,